Good morning. I'm Amanda Scott, the State Long-Term Care Ombudsman. I'm grateful for the opportunity to be able to speak with you today regarding the Ombudsman program and how the Ombudsman program can be of benefit to caregivers. The Idaho State Ombudsman Office is located in Boise and falls within the Idaho Commission on Aging. Idaho has 6 area agency offices throughout the state, which house the local ombudsman programs. The local ombudsman programs are an extension of the office of the state ombudsman and provide advocacy and services to residents who reside in long-term care. A long-term care ombudsman is a specially trained advocate who is authorized under federal and state law to assist residents resolve their concerns related to their care while residing in a nursing home or assisted living. Idaho was one of the 9 original pilot states to run a pilot on the Ombudsman program in 1974. The 1978 amendments to the Older Americans Act elevated the nursing home ombudsman program to a statutory level. The statute and subsequent amendments required all state agencies on aging to establish an ombudsman program that would investigate and resolve long-term care facility resident complaints, promote the development of citizens organizations and training volunteers, identify significant problems by establishing a statewide reporting system for complaints, and work to resolve these problems by bringing them to the attention of the appropriate agencies. Monitor the development and implementation of federal, state, and local long-term care laws and policies. Gain access to long-term care facilities and to residents' records, and protect the confidentiality of resident records, complainants' identity, and ombudsman files. In 1978, all states were required to operate a nursing home ombudsman program, and ombudsman regulations were added to the Older Americans Act. How many of you have had the opportunity to visit a loved one working in a nursing home in the 1970s and early 80s? The atmosphere of nursing homes was a lot different during that period of time. I recall training to be a CNA at a nursing home in 1984. I remember the smells, sounds that I witnessed. They are burned memories in my mind. I remember the halls being lined with wheelchairs and residents tied to their wheelchairs with soft restraints. Hearing residents crying out for help, being unable to even move themselves from their location on the hall. Having eyes in facilities was so necessary and important to the health, safety, welfare, and rights of long-term care residents. In 1981, the Ombudsman program expanded and provided services to members of the community, and also begun visiting residential care facilities. Ombudsman worked to improve the quality of life experienced by residents of long-term care facilities. The state ombudsman has the authority personally or through representatives of the office, which are the local ombudsman, to identify, investigate, and resolve complaints relating to the action, inaction, and decisions including the welfare and the rights of residents with respect to the appointment and activities of resident representatives, of providers of long-term care and of public agencies, health and social service agencies. The purpose of the Ombudsman program is to work to assure that residents of long-term care facilities' health, welfare, safety, and rights are honored. What might this look like? If a facility is not ordering a resident's medication in a timely manner, and the resident continually goes without needed medications, this can quickly become a health issue. Or if a facility is not setting up needed surgery as the doctor has ordered, this can become a health issue. A person's satisfaction is linked to their choices and the ability to exercise those choices. A resident needs to be able to exercise choices or preferences to be able to have the highest quality of life. The resident needs to have mental stimulation through engagement and meaningful activities and not just being warehoused in a facility. A resident needs to be free from abuse, neglect, exploitation, and live in an environment that provides a safe place to reside. The facility needs to provide the level of supervision that keeps residents safe, keeps the facility clean and free from hazards that could cause injury. A resident has the right to exercise his rights without taking rights away from other residents. Choice is one of those rights and increases the residents' quality of life and their experience while they are in the facility. The Nursing Home Reform Act of 1987 set the federal quality of standards for nursing homes in the US. Nursing homes are required to meet these standards if they receive Medicare or Medicaid dollars. The act protects residents from physical, emotional, and social abuse and neglect. The goal of the act is to ensure that residents receive the highest level of care, along with assuring the health, welfare, safety of residents residing in long-term care facilities. One of the main focuses of the Ombudsman program is to provide education on residents' rights and to advocate for residents to have the ability to exercise their rights. Be aware there is a big difference between nursing home regulation and regulations that oversee licensure in an assisted living facility. Nursing homes are federally regulated, while assisted living facilities are state regulated. There are no federal regulations that oversee assisted living facilities. What does that mean? It means that each state licensure department determines what they will regulate and how restrictive that regulation will be. In Idaho, licensing and certification, located at Health and Welfare, oversees licensure of residential assisted living facilities and provides regulation that facilities should follow. Assisted living facilities are based on IDAPA, Idaho Code, and landlord-tenant laws. That means a facility can give a 30-day eviction notice for any reason in Idaho. and can send a resident to the hospital. A facility can send a resident to the hospital for a medical concern and choose not to readmit that resident. There is nothing in regulation that prevents a facility from doing just that. But there are laws that facilities, assisted living facilities, fall under that are often overlooked and can be addressed through the complaint process, through Intermountain Fair Housing, through HUD requirements. Whenever considering placing a loved one in a facility, visit the facility, eat a meal at the facility, ask financial questions of the facility, ask about their policy on discharging residents, walk through the facility, see the room that the resident would be residing in, and clarify if the resident was to need to transition to Medicaid, would they have to share a room with another resident? Listen to how the staff talk to the residents and touch and interact with the residents, and visit more than one facility to have a comparison of facilities. Who are caregivers? They are people caring for people. They are children providing care for their parents and possibly their own children at the same time. They are grandchildren caring for their beloved grandparents. They are neighbors caring for someone who has no family to step in and provide care. They are co-workers who assist when there is not a family member around to help. A trusted friend, a spouse or life partner, an ex-spouse who steps up to provide care, parents and grandparents. Along with all of life's tasks, they are also providing many other services, such as calling in search of resources to meet the person's needs, taking them to appointments, helping with healthcare decisions, coordinating cares, preparing meals, and providing hands-on care. They frequently find themselves addressing crises that arise and battling for the rights of the person they serve. My husband has been medically retired for the past 17 years and has within the past 2 years had a decline in health. And I, for the first time, acknowledge that I am a caregiver and I am faced with many of the aforementioned tasks of providing care along with holding a full-time job. Caregivers do what is needed and what is required to keep all the balls up in the air. And at the same time, these responsibilities can be heavy on a caregiver. At times, they need help. Caregivers are often working full-time jobs, managing their home and family, and providing care for a loved one. With all of this on their plates, they don't have a lot of time to spend spinning their wheels. Caregiving need access to information and assistance. So, what are some of the caregivers' main needs? For one, finding someone who is willing to listen and then help. When was the last time that you had a problem that needed your action and you did not know who to talk to, how to access the information that you needed? And you called phone number after phone number, trying to get the right person with the right answer. Sometimes it's as simple as knowing the right question to ask. Many caregivers have never had to navigate the long-term care system and need someone to explain how to access information regarding conservatorship, guardianship, legal services available, Medicaid or Medicare, veteran services, facility options that would meet their loved ones' individual needs, gaining access to a loved one's records when facilities don't respond to your requests, knowing and understanding your family members' diagnoses, treatment, and care they are receiving. Assistance when your admission agreement or contract with the facility doesn't reflect what the staff are telling you. Access to information related to what the facilities expect of you and your loved one, and what the facility is required to provide in response to their needs. Access to what family and resident rights and responsibilities are. Assistance with resident care issues. Each caregiver's needs are unique to the person experiencing the issue at hand and needs to be addressed as unique to the caregiver and the situation that they are in. That requires someone really listening to what's going on and providing person-centered direction on what needs to be done. And at the same time, it takes an advocate's intervention. When the time comes to consider placement in a facility, it can be a stressful period for the caregiver, knowing where to find information on facilities in the area and whether these facilities are the best option for your loved one. This can be a daunting task, whether skilled nursing care is needed or whether an assisted living will meet the current needs. Whether a small facility is home-like or a larger facility that provides more activities and is more independent. Whether a memory care unit is required to provide a secure living area and cares. It is a lot to think about. Whether the resident will need a Medicaid bed and whether a facility has a Medicaid bed available. Most facilities do not provide a family orientation to what is expected of the family and what can be expected of the facility. Ask questions. Make sure that you read everything before you sign it. Don't allow them to rush you through. Make sure you get a copy of the admission agreement and keep it for future reference. Make sure the facility takes a clear and accurate inventory upon admission. Meet the staff who will be providing care, everyone from therapy to the CNAs and everyone in between. Check to see if your facility has an active family council. And if they don't, contact your ombudsman and request they help organize one in your facility. Communication is the #1 issue between staff and family or residents. Make yourself known and let staff know that you want to be kept in the loop regarding everything about your loved one's care. And if they are not able to do that, this is probably not the right facility for your loved ones. Staff, at times, not honoring the resident's dignity and treating the resident with respect. can be an issue. This is not acceptable. So let the facility know if you observe this, that it will not be tolerated. If you see staff treat a resident with disrespect, go to the administrator. Let him know what your observation was and voice your concerns. Care plans in a nursing home and negotiated service agreements in an assisted living should be person-specific. It is what makes it all come together and work. Request to be involved in the planning process. Facilities can't know what you have learned from a lifetime of living with your loved one, and you have the ability to share that, so their experience can run smoother. A resident has the right to have their preferences and likes respected, and a knowledge of dislikes can prevent a lot of conflict and heartache within a facility. Cultural differences matter. Don't assume that staff should just know, because often they do not. Take the opportunity to gently teach what is important to your family and to the resident. Food is often an area of dissatisfaction by residents. So let the facility know what foods your loved one prefers and how that food needs to be presented, whether or not it needs to be prepared in smaller chunks, or what the resident's preferences is. Family involvement can be construed as interference, but a reminder that you have always been their family and will always be. Nothing has changed in the relationship just because they are living in a facility. A genuine and honest fact is that facilities are struggling right now with low staff. This is a fact. This is not going to change overnight, because it was not created by COVID, only made worse. Staff can only do so much, but it is the facility's responsibility to determine how many staff they have and the needs of the residents residing in the facility currently, and whether they can meet their residents' needs before they consider admitting another resident. Sometimes attention to safety when staff are rushing to complete their many tasks at times can be an issue. When a resident is injured, request information and facts as to what happened, and request that it be well documented in the resident's record. Make sure that you document exactly what you have been told and by who, the date and time of the incident, and the conversations with staff. This will be important if different reports of the incident conflict with one another. I am going to now open up the meeting for any questions that you might have. No questions? Ombudsmen provide direction and assistance so family are more able to resolve concerns themselves. The greatest tool that a family member can have is that of empowerment. Knowing your rights and how to put your point across in a calm and controlled manner, and addressing things immediately and not waiting until boiling over when it's the last straw. It is your right to request a meeting with the assisted living administrator or request a quick care plan meeting in the nursing home to address concerns. Be prepared, take notes, and respectfully address all concerns. Try to end with gratitude for something that has been done right. Don't be mistaken. Family involvement makes for better resident care. Keep a good working relationship is important to make the needed changes when things arise. Hoping for the best and a willingness to try to help make things better is a positive move towards having good working relations with the facility. When you have tried to resolve issues within the facility and find that change is not happening, reach out to your local area agency on aging ombudsman and file a complaint or call for suggestions. Ombudsmen provide training to facilities, staff, family agencies, and communities on the rights of residents of long-term care. Through presentations and consultations, don't hesitate to call when you need information on senior issues. Ombudsmen are advocates for residents in long-term care facilities. What does that look like? We advocate for the resident. We work with and for the resident or resident representative. When the ombudsman receives a complaint, no matter from who the complaint came from, the ombudsman must meet with the resident to take the direction from the resident. If the resident does not have a guardian, and even if they do have a guardian, they will still meet with the resident. If the resident's call light is not being answered in a reasonable amount of time, we address with the facility as to why the call light is not being answered in a timely manner. All communications with other than the resident or resident representative is done with the permission of resident or the resident representative. Medication is one of the most frequent, mediation is one of the most frequent tools that the ombudsman can use. Just having the ombudsman involved in a complaint can often set things in motion to resolve the problem, even before meetings are set and participated in. Working to accomplish a goal with respect for the facility and the resources they have available, but with the expectation that a resolution can be met. Sometimes it takes giving and taking. Other times it is clear that issues need to be corrected. Residents need hygiene care to prevent health decline. It may be necessary to change somewhat a bathing schedule that has been observed for years to be able to get the desired care when staff are so short and rushed for time. But being able to choose the days to bathe may be the give and take to accomplish the desired outcome. Family may want to have lunch with their loved one on the weekend, but often staff can be leaner on weekends, and the facility may find it difficult to provide the assistance to family and meet the other residents' needs. Possibly offsetting the mealtime and the family bringing in the resident's favorite meal might be an option. Much of the ombudsman's time is spent on investigating complaints brought to the program. The ombudsman receives a complaint, meets with the resident to determine what it is that the resident wants the ombudsman to do related to the issue. We ask a lot of questions of complainant and the resident to make sure we understand what is being asked of us. With the permission of the resident or the resident representative, we observe, we review records, interview staff and other residents, and review regulations. When the ombudsman receives complaints about the quality of food within the facility, we speak with other residents to see what their experience is with the food. Often, when there is one significant complaint about food, it is a systemic problem and one that many residents have complaints about. When we find this, we are able to investigate the complaint by stating to the facility that we have spoken with several residents and have had multiple complaints about food. Food is cold when they receive it. Meat is tough and they can't chew it. And the food is burned or they are cutting back and there's not enough to eat. These are all general complaints, and the ombudsman is able to request menus of the month prior and the current month with any substitutions, and then to come to and then to visit the facility unannounced and observe meals and food quantity and quality. Once we have interviewed, observed, and reviewed records, we are able to address our concerns with the facility and give suggestions. If they do not respond to our request for change, then a complaint can be made to licensing. But the best and first choice is to try to resolve the issue with the facility. The ombudsman program are able to get into the facility a lot quicker than licensing can. As an ombudsman, I have visited facilities on the late night shift when a complaint has required me to do so, to be able to observe what the issue was. I have made visits on weekends when an investigation required it. The ombudsmen are not emergency responders, but try to address the complaint in a timely manner. Some complaints in some facilities are constant working efforts. How can ombudsmen be of assistance to caregivers? We provide information. The ombudsman provide information on senior issues and topics, anything from conservatorship, guardianship, on regulations, on whether a facility can limit visitation or limit a resident's access to the community. We receive complaints. We investigate complaints and we work to resolve the complaints to the satisfaction of the resident. One of the greatest things that we can assist caregivers with is to help them to feel that they are empowered, that they have the ability to be able to self-advocate and advocate for their loved ones within the facility. We also recommend changes to laws and to regulation. We work with legislation to create new laws or to address inadequacies in laws or laws that are restrictive. Recently, I had the opportunity of to be able to witness for House Bill 601 regarding visitation by family. The Ombudsman program during fiscal year 2020-21 investigated 988 complaints. They provided consultation, which is information and assistance to 1,639 individuals and received 905 calls requesting guidance or information and assistance, a total of 2,544. And the local ombudsman provided education, presentations, and trainings 89 times during that fiscal period. There are currently 280 licensed assisted living facilities. Now, that's not the number of buildings, that is the number of licenses, and 80 skilled nursing facilities with a total of just under 18,000 beds. There are currently 15 local ombudsmen to cover the state and do routine visits to facilities, complaint investigations, and to provide training presentations on senior issues and to provide consultations. We have come to the end of the presentation, and if you have any questions or comments, feel free to ask.